Hello, my name is Donna Arbuthnot, and the topic of my project is the ABCDE Fall Prevention Program in the acute care setting. Can inpatient accidental falls be predicted and prevented in the acute care setting? Falls and falls with injury are a major encounter for all healthcare settings and environments. Annually, 1 million falls are documented in American hospitals. Unfortunately, 90,000 of these falls result in serious injuries. Falls with injuries are constantly amongst the highest 10 reported sentinel events. The expected yearly direct and indirect cost of a fall with injury is predicted to exceed $54 billion. Nurses are ultimately responsible for patient safety and identifying those who are at risk for a fall or fall with injury. Inpatient falls as quality indicators must be improved via nurse-driven patient safety strategies. The purpose of this nurse-driven quality improvement project is to evaluate the effectiveness of a multifaceted, innovative, individualized falls prevention program that simultaneously assesses the patient's risk for a fall and risk from injury from a fall in the acute care setting. This project was based on a study in a large academic medical center that implemented a multidimensional falls program to include the development of a visual tool to reduce the number of falls by nearly 50% within 1 year. The goal and objective of the nursing staff and administrative staff is to ensure a culture of safety for all patients admitted. This process improvement initiative promotes quality, safe, and effective nursing care, which results in improved patient outcomes, satisfactions, experiences, and a reduced number of falls in the facility. This quality improvement initiative began with the creation of a multidisciplinary team that focused on the development of a multifaceted, innovative, individualized fall prevention program that simultaneously assessed a patient's risk for a fall and risk for injury. Consent from the patient for participation was not indicated or obtained. Both male and female adult inpatients admitted to 4D and 5D telemetry units were chosen to participate in the project. And the components of the project included the creation of a visual tool, the ABCDE Falls Prevention Bundle, and continuous staff education. The A in the ABCDE Falls Prevention Program focused on the assessment. The Morris Falls Risk Score was used to determine the risk for a fall. The ABCS, age, bones, coagulation, surgery, risk assessment was used to assess the risk for injury from a fall, and a patient self-falls risk assessment was included. The B in the ABCDE Falls Prevention Program actually stands for bundle. The items in the bundle included 2 fall risk armbands placed on a patient at risk for falling, a yellow falls precaution sticker placed on the patient's chart, non-skid socks, a low bed or a bed in the lowest position, purposely hourly rounding, a patient fall education sheet signed and completed by the patient or family, a nursing care plan initiated by the nurse, the incorporation of the falls score, the ABCS risk for assessment, and updating this information in the patient's room on the whiteboard. This information in turn determined the fall risk box. The fall risk box is a visual tool that was created and used to classify the patient's risk for a fall and risk for injury. The color displayed on the doorframe of the patient's room simultaneously indicated the patient's risk for fall and risk for injury from a fall. For example, the color red indicated that based upon the Morris score and the ABCS risk for injury assessment, the patient is at high risk for falling and a high risk for sustaining an injury as a result of a fall. The color orange indicated that the patient is a low risk for falling according to the Morris score, but a high risk for injury based upon the ABCS risk for injury assessment. The yellow color describes the patient as being a high risk for a fall and a low risk for injury from a fall. And lastly, the green colored box indicated that a patient is a low risk for a fall and a low risk for injury based upon the Moore score and the ABCS risk for injury assessments. The C in the ABCDE Falls Prevention Program is for continuous communication between the nursing staff, the patient, the family, and ancillary staff regarding the patient's fall status. The D defines the process of the debrief following a fall. The debriefing would include the staff involved, the patient, and the family if indicated and if available. The E in the ABCDE Falls Prevention Program is for ongoing education of the nursing staff, the patient, family members, and ancillary staff that encounters the patient. Each fall that occurs in the facility is captured by a hospital's patient safety reporting system and is archived indefinitely. The metric for this quality improvement project was the reduction in the actual number of falls on the pilot units. The measurement used to calculate the number of falls each month on each unit was compared to the historical data, indicating if the differences are statistically significant. A simple comparison was made in the data for each unit before and after an implementation of the ABCDE Falls Prevention Program. The data analysis and summary is as follows. In 2016, Pilot Unit 4D had a total of 36 falls. The monthly average was 4.5 per month. In 2017, between the months of January and May, 4D has had a total of 14 falls. The monthly average is 2.8. Thus far, we have seen a reduction in falls on the unit 4D by 1.7%. The other pilot unit, 5D, in 2016 had a total of 37 falls. The monthly average was 4.11 falls per month. In 2017, for the months of January to May, the total number of falls is 16, with a monthly average of 3.2 falls. Overall, the reduction has been 0.9% in the number of falls on 5D. Limitations of this quality improvement program were identified as the short length of time for implementation and the small sample size for data collection. 5 months was not enough time to implement and evaluate each working piece of the project completely. The amount of data collected was not adequate to make an appropriate assumption of the usefulness of the entire ABCDE Falls Prevention Program to include the falls risk box as a visual tool. The implementation of the ABCD Falls Prevention Program signifies a non-traditional approach to dealing with a global issue. The fact that the program is individualized, innovative, and interactive are key concepts that will impact the process of ongoing awareness, education, and communication. The positive results indicate that more time is needed to evaluate the effectiveness of the visual tool. Ongoing staff education, administrative support, and creating a culture of safety is vital for the reduction in the number of falls in the facility. The falls risk box should be continued and emphasized as a communication tool to address improved staff communication, education of patients and family, and ancillary staff in the hospital. In closing, inpatient falls continue to be a phenomenon that challenges healthcare systems. Falls are a serious threat to patient safety and outcomes. There is an opportunity for improvement in the assessment, planning, intervention, and evaluation process that address inpatient falls and falls with injury. The proposed quality improvement initiative is individualized to each patient, innovative with the dual risk assessments of injury and fall, and interactive as it includes the entire healthcare team, the patient, and the family. This program is a unique concept for quality improvement, creating a culture of safety, and improving patient outcomes, experiences, satisfaction, while decreasing the number of falls while patients are admitted in the hospital. Falls can be predicted and prevented in the adult population in the acute care setting. Thank you.